Hello and welcome. I am Dr. Ankit Parakh. I work as a consultant in pediatric pulmonology, allergy, and sleep medicine at Children's Chest Clinic, New Delhi. Is your child very sleepy during the day? That is what we are going to talk about in this video. What are the reasons which leads to a child being very sleepy in the day? What are the problems associated if a child doesn't get adequate sleep and sleeps during the day? And then we'll talk about how do we make a diagnosis and treat these children. Now, excessive daytime sleepiness is a common problem which is seen in children, especially adolescents and young adults. There can be many reasons why children are very sleepy in the day. The reasons could be that one, they do not get adequate sleep at night, which might be due to studying during late hours and getting up early in the morning. It might be due to bad sleep habits, that your child might be on the mobile or on the laptop or the iPad for late night and hence doesn't sleep properly and again wakes up in the morning. There could be problems like a delayed sleep-wake syndrome where the biological clock is shifted. So the child sleeps late, 3 a.m. or 4 a.m. but also gets up late at 1 p.m., 2 p.m. in the afternoon. But if the child is woken up early in the morning, the child does not get enough sleep. So that is one important reason of being excessively sleepy during the day. The other reason could be that the child is sleeping in the night but is not sleeping properly, which means the sleep is not of good quality. Now, this happens in children who have obstructive sleep apnea and children who have a restless leg syndrome. In these situations, the child gets frequent arousals at night, and that happens at the brain level, which we cannot see. So even if the children have slept for 8 hours, 9 hours, or 10 hours in the night, they do not get enough sleep in the night, and hence they are sleepy in the day. The third reason which can lead to a child being very sleepy in the day are primary sleep problems where the sleep need is increased. Now, these disorders are either narcolepsy or a Kleine-Levin syndrome, but these are something which are not very common in children. What can be the problems which are associated with the poor sleep and being excessively sleepy in the day? Now, sleep is something which is as important as food. We all sleep for 8-10 hours a day. So sleep is extremely important. And if a child doesn't sleep properly, the child will have problems with health. So it has been seen that children can develop increased blood pressure, their sugar levels can go up and down. They may not feel well. There can be a lot of behavioral problems like swings in the mood, like anxiety, like depression if they don't sleep properly. There can be neurocognitive problems. They're not able to concentrate properly. They're not able to perform properly. There can be deterioration in the school performance. So these are lots of problems which are associated with not sleeping properly and being very sleepy in the day. Now, how do we diagnose children who are very sleepy in the day? Now, any child who is very sleepy in the day requires to be evaluated with a pediatric sleep specialist. Now, how do we go about making a diagnosis? So usually it starts with a detailed history and an examination of the child. We would like to see how the child is going into sleep, for how much time the child takes to go into sleep. Does the child have frequent arousals? And usually this is followed by making a 2-week sleep diary. So sleep diary is a very simple document which we will provide you, and where you or your child or both of you are supposed to mark the hours of sleep. So when the child goes into bed, when the child actually sleeps, when the child actually wakes up, what are the activities the child is doing. And these things are recorded over a period of around 2 weeks. And this gives us a lot of information which helps us to understand the sleep pattern of the child. Now, after this, there are a few investigations which can be done. So these investigations could be in the form of an actigraphy, which is in the form of a watch which is worn, which again records the child's activity and sleep. Few children might require something known as a sleep study or a polysomnography. Now that test is a technical thing which is done either in a sleep lab or sometimes at home, where we record the breathing of the child, we record the snoring of the child, we record the oxygen and the carbon dioxide levels, and that is done for the whole night, and then the results are evaluated. It is an investigation which is extremely useful for diagnosis of sleep apnea in children and restless leg syndrome. There would be few children where we consider that the sleep need of the child is increased. As we have talked about, these disorders are rare, but they do happen, such as narcolepsy and the Kleine-Levin syndrome. And in these disorders, we would need 2 investigations. One is what is known as an MSLT or multiple sleep latency testing, and a sleep wakefulness test. That tells us that how much time the child takes to go into sleep. And children with narcolepsy go into sleep during the day very quickly, and they enter into a phase known as a REM sleep. So if your child is sleepy in the day, you don't need to ignore your symptoms. It can have a harmful effect on the child's health, in the child's mental functioning, and overall well-being of the child. So if your child have any of these problems, you do need to consult a pediatric sleep specialist for proper evaluation and treatment. For more information, do log on to our website, untitledchapter.com. Thank you.